everyone. Thanks for joining me today on my Facebook Live. My name is Dr. Sally Foote. I'm a veterinarian and behaviorist with over 35 years of veterinary experience. I publish and educate on low-stress veterinary care. It's blending the fear-free, low-stress handling and cat-friendly practices, along with integrating knowledge of pain relief and good medicine and nutrition for dogs and cats. You can find me at my website at drsallyjfoote.com. Today's topic on this Facebook Live is I wanted to present the American Association of Feline Practitioners updated guidelines for cat-friendly care, feline-friendly, cat-friendly care. Now, the initial guidelines were published in 2011, and an update was then just published here in November of 2022. And the guidelines have really expanded. So I thought to myself, well, so I'll look them up because I hadn't read them yet. And so the guidelines, first of all, they're very thorough. And they're divided into two. And one is the environmental guidelines for the veterinary environmental experience, meaning the practice, how things are set up, etc. And then the second one is on feline-friendly interactions. And each of these guidelines is about 100 pages long in its publication. So at first look, I thought, wow, especially if I was still in general practice, while all my intentions may be good to want to go through these guidelines, read them, and apply them, it's kind of a lot to go through. So I thought, but we want people to have these in use, and we want people to really know, well, what's updated, about these guidelines. So I thought I'm going to approach this today, this presentation, this discussion about these guidelines today from not only, well, what's in them and what's good about them, but also like how to use them in practice in a way that is really applicable to the practice that we're in, the situation that we're in, and the people that we serve. So first, there's a summary. You can find the summary, and I'll put this in the links in the my Facebook post here. And also, I always upload my Facebook lives to my YouTube channel. I'll put these links into the YouTube channel information too. But basically, the press release here, talked about the updated guidelines, and these guidelines are endorsed by 27 international veterinary and feline welfare organizations. It's well supported in these guidelines. And so some of the things that are really being emphasized now with our expanded knowledge of, low stress care, etc., is that implementing the cat-friendly interactions is that we want there to be minimum handling. And I think the whole hands-off and less is more approach has been very well informed, and a lot of ways to do that, but also that allows the cat to have a sense of control and choice, and that training every team member how to do this. So this is where the cat can leave, the cat can move away, that we are not holding them tightly. Excuse me, I got a notice popping up here. Sorry. Okay, so we're not holding them down, holding them tightly, or having them feel trapped, in the back of a cage, reaching for them, etc. Now, I will say, though, that if we're in emergency care or an urgent care situation, in other words, rescheduling this examination may delay needed medical care, or we do have to work with the people we have, not only our staff and their ability, but the clientele. Can the client bring the cat back in? Does the client have the ability to leave the animal for the day or not? So we have to weigh all these things out. So there are at times in care where we may not be able to allow the cat to just, leave, to jump off the exam table, or say, well, we'll quit and come back to this in an hour after we've had an hour for medication to take effect. That may not be really practical in this moment in the situation. So I think we need to have compassion for each other, that this is a guideline. It is not an absolute. We're always going to do everything we can to minimize the stress, to minimize give some level of minimizing the feeling of the cat for being under, like, held, no hold tight holds and things like that. So let's have a little compassion for each other, that if we have to give care, that we may need to use not only a towel to cover them, but some other tools. And that in the use of these tools, that we want to make sure that those tools are used in a way that is not stressful, and that maybe even took time to condition the animals to things like a muzzle or other things like that. Okay, now another second point of this is we want to educate caregivers how to decrease distress while traveling to the veterinary practice. So of course it's great if we can have our clients keeping the carrier out in the living room and feed the cat from there and prep the cat for a number of days before coming in for the exam. At the same time, someone may have called today and said, hey, my cat is having trouble breathing. And that needs to be seen today. And he hates being in the carrier. So for us to know alternatives to the traditional carrier that would have the cat be safe to be brought in. So for example, putting him in the laundry basket with the top on top, okay, bungee corded down. If that is a way to quickly scoop the cat in there and he's less agitated in that than in the cat carrier, that's fine, use it. A lot of cats do like pillowcases slipped over them, especially from home. Why? Because it smells like home. Slipped over them, and because they don't see any triggers, it's not the carrier. They're so negatively associated with the carrier in the pillowcase, they may even lay on the client's pillowcase at home. And that's in that way that is less stressful for the cat, because we have to see the cat. He's having a breathing problem, or maybe he's drooling and is not eating and hasn't eaten for 2 days. So again, these are guidelines, especially on the listing of the tools, that we need to bear in mind. We may not be able to absolutely always follow these every single case, yet if we're applying the concepts and the base core of what these guidelines are telling us. So prepping the animal for traveling. So what we could also do is tell our clients ahead of time of like what to have handy. But if you're in an urgent care or emergency care situation, think of some alternative carrier types that are easy for a client to use or easy for them to get the cat into, that is going to be less stressful for the cat to be in. We want to create experiences that consider the cat's natural behaviors and altering an approach to each individual cat. So that means really that instead of thinking, well, all cats should be covered in a towel, because some cats don't like towels versus cats that do, or all cats like it when I face them and do slow blinking. And while that may be very calming to the majority of cats, if in this particular cat it's not calming, don't do it. So we need to make sure that we are looking at each cat as an individual, while still though, yes, you will have like a general protocol or general standard setup that will help for most all cats. It's okay to use this general standard setup for all cats, but you've got to have enough, let's call it tools in your tool belts, with knowing the skills to use for changing your approach and changing approach, changing touch, changing how you're doing something, so that you're always reducing that stress. So you really know how to read the body language, and you're using like your ladder of aggression charts. Yet we may not be able to always individualize the plan in that moment. So again, let's have a little bit of compassion for each other with how we use the guidelines according to the clientele that we have, the staff skill level that we have, and the medical situation at hand, that why the cat is there. Creating an environment that considers and implements ways to reduce fear. So again, sometimes in reading these guidelines, we may think like, well, I can't set up a cat-only exam room. I only have 1 exam room or 2 exam rooms in my small practice. And that may be true. That may very well be true. So creating an environment can happen in a few moments. It could be as simple as, in those few moments, we put a towel down to cover the stainless steel exam table. No, I could not eliminate every smell of a dog in the room, because I just saw 4 dogs in the 4 appointments before this. Yet I can cover this stainless steel table. I could spray some Feel Away on this towel and make sure we turned off the phones and we got the barking dog outside. That is creating an environment that is considering the cat's needs, while it may not be perfect. So for those of us where that's the best that we can do in a situation, please let's support each other in it, because we are following this guideline. You know, and we also, knowing that the whole veterinarian team understands the particular behaviors of cats and their emotional states. And in other words, how they escalate up in anxiety, how that body language looks, subtle though it may be, and will they'll switch over to swat, stare, and possibly attempt to bite. So we do not push them over into that, because the cats as a species are going to be longer to de-escalate. It may take a whole hour if we've pushed them up to the point of really struggling and finding us out. We do not want to go there, okay? I think so as you can see my big stack of papers here, these are only parts of the 2 guidelines that I printed off. And what I thought would be, like, if I was in practice, what would I do? Well, this right here, I've just printed off this section of the guidelines talking about equipment, okay? Like using towels or using, you know, quiet clippers. And the guidelines do have nice photographs like this. So I thought, you know what? An easy way to use this in general practice could be, we take just this section of the guideline, maybe focus on this aspect of it as we're working through to improve things in the clinic. And we can make almost like a chart of, like, cutting out this photograph and say, use the quiet clippers, you know, these, etc. Or like how to put the lidocaine cream on the leg before we do a venipuncture, or we put in the IV catheter. But we can make like a simple wall chart as a visual reminder for us to follow these things, to make it easy to follow these guidelines. And also, maybe this is the aspect of handling, the aspect of feline care that we want to improve the most upon. And while there's a whole lot of other things to know, if even at my practice, this is the one part that we're doing better with, that we're improving, it is overall improving the experience for the cat, the experience for the staff, and we can then add on each other, you know, section of the guidelines as we continue down the path. And that also we have compassion for each other within this profession, within this world, with where we are, who works with us, meaning what kind of clientele, what is their financial resources to be able to come in or not, to spend money on, you know, rechecks, etc., or even rescheduling or medication and such. Our staff level, do we have plenty of staff to help out with taking care of things, or are we really limited in our staff so we don't have a lot of extra hands for some of the time it takes for cooperative care, positive conditioning prior, so that we always give the cat agency? Well, as long as we can decrease the stress, we can give them as much agency as possible, as well as being safe and minimizing risk for any kind of injury, like the cat struggling or having injury to themselves or to the staff. Thirdly, that we have compassion for each other and where we are with our own life stages, because remember, the bite from a cat, and cats, when they do quickly escalate up, or even just grazing of the tooth, can cause severe infection in some people if we're immunocompromised or different health stages. So that if I need to wear gloves to protect my personal health, in the event that when I palpate, go to examine that mouth, and there's a sore tooth, and the cat might turn and give a small nip to my hand that I could not necessarily predict, no matter how good I am at reading the body language, I am not going to end up with a severe blood infection. So that wearing the gloves is not, and they're not used in force, and when I wear the gloves, I give the cat baby food, so he likes to see me in the gloves, that we support each other in this. And lastly, that this is something that the more that we give each other the understanding and space for how we use and apply these guidelines as best we can, that's how we're going to get more of the guidelines used. We're going to develop and have more application of things like cat-friendly practices, and not see this as kind of an either-or. Either you're completely following it, and maybe a certain veterinary program is cat-friendly versus not. Frankly, I see this as we're all in this together, that all of our programs that are to promote good medicine, personal safety for the staff, safety and welfare for the animals, while bringing it all together in an integrative way, is cat friendly. So thank you everyone for listening today. I'll have the links for the handouts and things. I look forward to your comments. Take care and have a great day. Bye-bye.